Okay, so for chapter 6, it's called Tropical and International Public Health. Ultimately, this chapter didn't do much for me informing me about my topic, and most of what was stated was not so far different to previous chapters, um, even though the author explains how different the tropics are to other climates. The author covers how the tropics became a separate area of study. The author proposes that Europeans had a certain way of looking at things in regards to global biological variety, which was due to the developments of geography, arrangement, and sciences of classification. The author argues that the British became more separate from the Indians by emphasizing racial differences, and they emphasized having better hygiene, and they wanted to reduce overcrowding in the mid-19th century, which was the key aspect of improving their military mortality, and particularly in tropical conditions. I feel like the author brushed lightly on that topic. It seems that there is more behind that than what was stated. I mean, by using the words overcrowding, I don't think there really is any such thing as overcrowding. The world's big enough for everybody. I don't know what the measurement was for overcrowding, but I didn't like how I didn't like how the author phrased that. The discovery of microbiology and germ theory helped Europeans gain knowledge about diseases of warm climates, which was when research shifted its focus to the possible opportunities that was offered by tropical diseases. For tropics, the most common disease was malaria. Malaria causes high morbidity and mortality rates. British researchers developed two approaches that were resulted from the tropical medicine, which were used to control the epidemic diseases. The two approaches included vector control and insect habitat. The approaches were used to stop disease transmission as well as try to eliminate the insect from the disease cycle. As for the French, they used a different approach, which was to use population screening and eliminate the parasite from the host. The author argues how race was very significant for the tropics, and the author explained how there was a problem of uncontrolled African sexuality, and the author noticed it was particularly female sexuality. Up until World War II, quarantine and closing borders was a common tactic. By the time of World War II, international cooperation emerged through areas of economics, law, and welfare organizations. During World War I, ILO and LNHO were implemented into the public health system. ILO had the role of protecting employees against poor working conditions and was based on scientific evidence on health consequences from particular hazards. Excuse me. LNHO used statistics as a means to help come up with biological standards. After the war, the author proposes there was optimism for new antibiotics. These antibiotics included the breakthrough discovery of penicillin, and smallpox was eradicated by 1980, and the Western economy soon after within the same time of the 1980s and after the 1980s became very limited on what it could spend on health services due to the increased cost of oil prices and the increased cost of healthcare itself. The author argues since the 1960s, the U.S. had a fear of having limited resources due to the increase in consumption. And lastly, the author talks about at the end of the chapter how after World War II, there was an increase in international actions. There was a broader range of global institutions that became more involved in global health, which influenced America and everyone else's public health system. And that's what the chapter is about. Okay.